Good evening medicals, welcome to Medical Students Corner, myself Dr. Krishneshwari. Today is Thursday and today we are going to interpret a very important lab investigation which we are seeing in our daily practice, and our lab investigation is CRP. CRP, it is also known as C-reactive protein. It is a protein which is reacting to something. Okay, from where it is produced? It is produced from the hepatocytes of our body. From the liver it is produced. For which it is reacting. So it is a acute phase reactant or acute systemic reactant which is reacting to acute tissue damage or acute inflammation taking place in our body. You understand? C-reactive protein, it is. Now you understand it is acute phase reactant. It is a reacting protein which is produced from our liver, and it is reacting to acute inflammatory conditions and also acute tissue damage. Okay, so what is the significance of this CRP to ESR? Why this CRP is superior to ESR? So this CRP, it is a more sensitive acute phase reactant, hence it is superior to ESR. It is a more sensitive acute phase reactant. Then we told that it is a reactive protein. Then what is this C? C stands for C polysaccharide. C polysaccharide of pneumococcus. Pneumococcus, which is present in the capsule of pneumococcus. So it is found as a factor which precipitates the C polysaccharide of pneumococcus, and it is the first time it was found out, and so it is known as C-reactive protein. So what is the role of C-reactive protein in our body? The role is it opsonizes the invading pathogens. That is, it increases the risk of phagocytosis for the invading pathogens. Okay, that is the role of C-reactive protein. So when this C-reactive protein gets increased, so this C-reactive protein gets increased within 6 hours. Okay, in 6 hours of acute reaction, acute process, within 6 hours it gets increased, and the half-life period of C-reactive protein is 18 hours. Half-life period is 18 hours. And so what happens is, at once this inflammatory process is subsided, this C-reactive protein will start decreasing. You understand? This is the significance of C-reactive protein. Let us see this. In which conditions this C-reactive protein gets increased. Before that, we will see the normal value of C-reactive protein. So we have said that, I have said in the last session that we will be discussing on the normal values of standard textbooks, and according to Davidson, the normal value of C-reactive protein is less than 5 milligram per liter. 5 milligram per liter. 5 milligram per liter, and according to Harrison, the normal value is 0.223 milligram per liter. 0.223 milligram per liter, and if it is increased than 5 milligram per liter, we can say that there is some inflammatory process or acute phase reaction going on inside our body. Now let us see in which conditions the CRP gets increased. So first is infection with bacteria, virus or fungi. So in severe bacterial, fungal or viral infections, it will be greater than 300 milligram per liter. In severe infection, it will be greater than 300 milligram per liter, and in moderate infection, it will be between 50 to 150 milligram per liter. Understand? Infection with bacteria, virus or fungi. Second is necrotizing bacterial infection. Necrotizing bacterial infection. In this case also, this is same. In severe, it is greater than 300, and in moderate, it is between 50 to 150 milligram per liter. And third is chronic bacterial infection. Chronic bacterial infection such as TB, infective endocarditis, and also localized abscess. localized abscess. Here it will be between 50 to 150 milligram per liter. Then fourth is acute inflammatory conditions. Acute inflammatory conditions such as Crohn's disease, polymyalgia and infective arthritis. It will be between 50 to 150 milligram per liter. You understand? So these are the instances where CRP will be increased. When there is infection with bacteria, virus, fungi, when there is necrotizing bacterial infection, when there is chronic bacterial infection, and also acute inflammatory conditions such as Crohn's disease, polymyalgia, infective arthritis. Now let us see some of the inflammatory conditions or systemic condition where this CRP will be normal. Okay, CRP will be normal or slightly increased. Normal or slightly increased. So the conditions such as inflammatory conditions such as ulcerative colitis, SLE. In these conditions, this CRP will be normal or it is slightly increased. There is no significance of CRP in these conditions. You understand? So you should differentiate. You should not think in all the inflammatory conditions the CRP will be increased. You should not be mistaken for that. That's why I am saying this. In inflammatory conditions such as ulcerative colitis and SLE, it will be normal or slightly increased. Then in case of Sjogren's syndrome also, it will be normal or slightly increased. In systemic conditions such as leukemia, multiple myeloma, also it is normal or slightly increased. And if in case it is slightly increased in inflammatory conditions or these conditions such as leukemia or multiple myeloma, you should think there is some acute inflammatory process going on in between these inflammatory conditions. You understand? It is not specific for these conditions, but you should think that there is some acute inflammatory process going on inside our body in midst of this inflammatory and systemic conditions. So these are the significance of CRP, and also in some studies it is said that the CRP will be increased. Raised CRP, it is a marker of myocardial infarction, that some inflammatory process is going on our body, but it is not a proved fact. So when there is some inflammation going on our body, particularly this infection, CRP will be increased. So I think that you understand the significance of CRP, and now if you are seeing CRP increased in some investigation, you should think all these conditions. Okay, hope that you have understand the session, you are happy with the session. So please subscribe, please share. Any doubt, please let me know. Thank you so much.